Right, so welcome everyone, and welcome Aisha to the first vlog for Samuel West Birmingham CCG or Black Country in West Birmingham STP as well. Our first vlog is looking at social prescribing and the impact it's having on patients, and in this case in Dudley CCG. Aisha's from Dudley CVS, is that right?
Yeah, that's correct.
Yeah. Welcome, Aisha. Do you want to tell us a little bit about yourself? Or tell us about yourself and what your role involves.
Yeah, so my name's Aisha and my role title is a link officer. So it really involves basically working with GP surgeries in Dudley to support patients. And I've been doing this now for about nearly 5 years. And as a service, we're called Integrated Plus, and we've been going for about 7 years now. So we've got quite a good history of experience behind us. We're quite a highly skilled team, so yeah, that's us in a nutshell, really.
Okay. So, social prescribing, do you want to tell us a little bit more about what that is and what that involves?
Yeah, so in a nutshell, we work holistically with patients that are referred to us from GP surgeries, and we support them to engage with services, make changes, and build their network for a happier, healthier life. We spend quite a lot of quality time with individuals, and we really focus on actively listening to their story so that we can understand them. We take a very much a person-centred approach to consider how the individual can be supported to make positive changes. And we work quite collaboratively with other health professionals, services and community groups to coordinate a package of support for that individual. As I mentioned before, we're quite highly skilled as a team, and we use a range of techniques to support people so that they can get the most from working with us. So we use a lot of asset-based approaches, solution-focused and motivational interviewing techniques. So that's what we do with people.
Wow, okay. So, have you got any examples of where you've come across a patient and they've made quite like a profound impact on you and your role, and you've looked back and thought, wow, you're really amazed at the differences they've made? Any examples you can think of?
That's a really difficult question. I think on a personal level for me, all of the patients that I work with have a profound impact on me because I connect with them on such a deep and human level. And that relationship involves giving part of ourselves away and also taking on elements of that person, such as the challenges they face and their struggles. That level of human connection and awareness that people are often struggling due to circumstances that are often outside of their control, or they have very little control over them, or they might have had previous experience in life such as trauma, and it's a really big leveler. And it really forces us as practitioners to acknowledge our own human nature and our complexities as individuals. Because of this, we're able to connect with near enough everyone we support on quite a deep level, and that drives us to want to do the best that we possibly can to support that person. And we also often go above and beyond as a service because of that. So I couldn't think about one patient that's had a profound impact on me, because if I'm completely honest, that connection that I develop with each and every single one of them has an impact on me, and that's why I do the job.
Wow, that's amazing. Thanks, Aisha. The funding that was made available through NHS England to all of primary care, was a new, what they call primary care networks, was made available last July. So it's still quite a new concept in primary care, social prescribing. Even though social prescribing itself has been called other things, arguably before that, for many years now. But that in primary care world, it's quite a new thing. For those who are quite new to it in primary care, so GP practices, primary care networks, what kind of advice would you give them if they wanted to be able to provide the best type of support for their link workers?
Okay. A big part of the job is visiting people in their homes and providing that holistic support, and that by its nature means that we're often the first service that truly hears a person's story because we are so holistic. This can be really emotionally and psychologically taxing on us, and good clinical supervision is really key to how we deal with that as link workers. So having sessions with a psychotherapist or a counsellor in relation to the role that we do is really important. We often hear about really difficult experiences from people, such as abuse, and being able to explore how this affects us with those practitioners makes us better at our jobs. So that's a really key thing, is having good clinical supervision in place if the PCN are able to do that. Another thing that I think has really helped us as a team is having access to good quality training, learning and development. So as a team, we're really lucky because we've been supported to access a wide range of training, and that enhances our practice and supports us to be able to help people effectively. And we use methods and models that actually work, they're evidence-based. So that means that we're able to do our job really, really well. And it also allows us to be prepared for many different eventualities. So if a patient is experiencing thoughts around taking their own life, we as a team, we've got experience in that, and we've also been trained to quite a high level to be able to support people through that. So as a team, we're constantly learning and developing our skills, and we've now got to a point where actually very little shocks us or is outside of our skill set. And we each have our own specialisms as well, so we lean on each other quite a lot. So if any new link workers can be encouraged to link in with their regional learning network, that's always good, because there's link worker champions who they can lean on for support as well. So I think encouraging them to connect with that is a really good idea. And then I suppose having, kind of going back to basics, having the tools to be able to do the job, IT, a work phone, personal safety equipment, particularly at the moment, it's even more important if we're visiting people in their homes. That's kind of goes without saying really, but I think that that's really important to make sure that we've got the tech and the equipment to be able to do our job well.
That's brilliant. That's awesome. So finally, I suppose, just to kind of conclude, how would a GP or a primary care network going about getting into contact with your service if they found someone that they thought might be eligible, they thought someone who, for example, might be suffering from or struggling to come to terms with their long-term condition, and there were things that they weren't quite grappling, that were actually outside their medical needs? How would they go about getting in touch with you guys?
We're quite well known with the GPs around Dudley, because we've been working with them quite a long time, and we sit on the multidisciplinary teams that meet on a regular basis at the GP surgery. We take referrals in those meetings, but we also have referral forms that are embedded into EMIS. So a lot of the GP surgeries can submit a referral through to us with relative ease through their system that they're using to record patient information anyway. So that's how they can typically refer into us in our locality.
That's brilliant. Thanks so much, Aisha. That's it for today. It's our first, hopefully, of many more vlogs to come. Next month, we're going to be probing a little bit more into what we mean by stress supervising link workers. And we're going to start to peel the onion in terms of looking at the new roles in personalised care around health coaches and care coordinators. So what's happening on that front as well. In the meantime, thanks very much for joining me, Aisha, and I look forward to seeing you soon. Cheers. Take care.
Thank you.